I don't normally do this, but I'm going to go through your qualifications just because they're so impressive. And I also want to establish that you know what you're talking about. So, MD, PhD in cognitive neuroscience and clinical neuropsychology, associate professor at the School of Health Sciences and Psychology, Canadian University, Dubai. I have it all correct? It is impressive.
Thanks.
Thank you so much for joining me today. I appreciate it.
Thank you very much.
So I'm going to start with questions from my wife. Now, I'm 59. My wife is 62. And I think her age would pretty much give away some of the challenges that she's dealing with. Okay, so the first question from my wife. Why do women ruminate and lose sleep while men can knock off like it's any other day?
That it is partly, related to the peculiar differences in the human biology when it comes to feminine and masculine, features. Uh, Sometimes the level of stress, overthinking, overregulating thoughts amongst some women. Number one, because the nature of their scrutiny to details, uh, the her brain thing,
Mm-hmm.
and the other thing is about the changes in the hormonal level, especially when they are in the fluctuations in the monthly hormonal level. They might be experiencing some challenges falling and maintaining sleep, and it's not always there, but it happens. And especially when they are stepping into the menopausal period, so they have this knock off of the hormones, they start to have some autonomic problems. And what do I mean by autonomic problems? This means that the structure of the nervous system, that they lie outside the brain and they travel all across the body. They innervate the heart, the lung, bodily organ systems, the guts, the skin sweat glands, and also even the metabolic pathways, endocrine pathways, immune pathways. They're all getting negatively affected based on the hormonal changes, right? And that leads to something we call it like a postmenopausal circadian sleep wake disorder. And it's one of the 84 different types of sleep related disorders as per the latest classifications, right? So it happens to females at certain, you know, uh, age windows. And but it is not only about their hormones, of course. Anyone, either male or female, can experience certain type of all those different, quite diversified list of sleep disorders whenever in their life, but it needs to be investigated. It needs to be found out. But I mean, if I think at my feet, that would be mostly related to hormones and personality traits, chronic anxiety resulting in insomnia related disorder.
Okay, so that's the explanation. So, what do I do when I go home and my wife asks me what you said? What is the solution?
Well, first, to be able to calm and quiet the brain and body, to have some rituals and consistent habits in the evening hours.
Is that really important, that consistency before bed?
Of course, that is important. That's one of the, super uh, influential aspects of sleep regularity. And we need to have those related sleep habits, health related sleep habits. And when it comes to late evening hours, we need to be able to quiet our brain, to our mind, our body, doing mindfulness based meditation, relaxation, yoga, the power of silence. Some people do praying or whatever, they are really into it. And steer away from all those disruptions, following through those do's and don'ts of the sleep hygiene recommendations. And when they follow through that, they will be able to set the stage and the ground ready for a quality sleep. If it doesn't happen, then there might be some biological medical reasons behind it. There are medications. There are specific types of autonomic, remediation. We can do that with some sort of technology-assisted exercises to calm down the body, the bodily nervous system, and the brain. And some medications or vitamins, supplementation of some neuropeptides or hormones, including melatonin. But it should be very well decided by a sleep expert, both not only for the dosing but also for the timing and everything. And that is one part. When it does the trick, and when they wake up in the morning, the first thing is to reverse that case scenario. early exposure to light in the morning. It's going to be a game changer. So taking those supplements, medications, following through the sleep hygiene measures, self-quieting exercises in the late hours in the evening, plus the wake hours, exposure to light, starting off the day. So this cycle will serve the cause.
You would be able to, if you were speaking to my wife, if you were seeing her as a
Yeah,
patient, you'd be able to diagnose what she's dealing with and what she's suffering from.
Yep.
But would you be able to give her, again, this is based on my wife's research, would you be able to give her the prescription to solve her problems?
Yeah, prescriptions are
And not necessarily medical prescription, but habits.
Prescriptions, when it comes to medical prescriptions, could be part of the game. Sometimes it is needed, and we pursue with that.
Right.
But the habits are actually very straightforward. Again and again, I reemphasize on that. I cannot stress that more on it. Following those common sense but uncommon sleep hygiene things. Number two, staying hydrated, being mindful about the diet habits, also staying physically active during the day, because we need to expend that energy during the day to be able to regain that energy overnight, right? So if we're staying active during the day, taking certain number of steps or cracking the gym or any type of exercises that we're into, that would be very good. Steering clear from tobacco products, alcohol, of course, and as much as possible staying away from environments or contexts that they are putting me in a hard feeling or giving me the hard time, toxic people, environment, as much as possible. So when we go through those things, it will help my body and my brain to get back on track with regard to the harmony that I deserve, my body craves for. And that will result in the brain and body ability to get this hypnic tone at the evening hours. If that doesn't do the trick, then the sleep physician might be evaluating it. There might be a reason that something is not right, or we need to get it tested as much precise as possible. And then that is as per the gold standard testing measure, what we call it, polysomnography or overnight sleep test. There are sensors that are being attached to the surface of the scalp to read the brain and also read the body with the several set of sensors. We study the biology overnight, and it takes, for me, it takes 4 hours to vertically analyze those signals, put the bottom line diagnosis, and go for precise and workable solution as good as possible.
Question number 3 from my wife. Why do women generally wake up like wide awake at 3:37 a.m. every night?
Depending on the age, there might be several reasons. Like what I alluded to before, one of the reasons could be hormonal fluctuations. The other thing is about the type of, diet that they follow. If they take heavy meals or too much of, glucose or sugar at night, that might not be productive, or at some level when they are taking too much of fat or less of the protein, that might not be productive, because the brain and the digestive system need to remain in that harmony. And somewhere at 3 p.m. when I have this drop in my glucose level, because when I take too much of glucose, that's going to increase my insulin level, and the insulin limit is going to fade away that glucose in my blood. So by 3 a.m., my body does not feel that is actually in the harmonious state. So it gives the alarm to the brain, and then that is one reason. So the sleep-related habits play a part in that, and depending on the age, when we're talking about, elder population, there is one gland in the brain called the pineal gland, and that pineal gland produces a peptide, a protein it's a hormone. Hormone is called melatonin. And melatonin has receptors in some other areas in the depth of the brain that they work in concert to set that biological timing of sleep and wake. Over years, when we get older and older, there is like degenerative changes in that gland, which is pineal. And when we study that pineal gland in those people who have had this, it turns out that the tissue of the pineal gland shows some black dots. We call them pineal sands. This means that neurons are dead there. So there is less of the active neurons producing melatonin, and we have melatonin like insufficiency. That's why the exogenous melatonin is being prescribed by the doctors. But it's not simply over-the-counter thing, because it might, lead us astray. Because when we take too much or too little of melatonin at the wrong time, it will be actually not only not being able to serve the cause, but that will be even making the case scenario even worse. So supplementation with melatonin, with some kind of herbal remedies that they are putting the brain and another chemical system called GABA in the brain, putting them back into a harmonious state, it will help the brain to regain that ability to set the biological rhythm for the need for sleep. They can fall asleep, maintain sleep, and wake up refreshed and rested and just ready to start off the day next morning.
Question number 4 from my wife.
Yep.
How do you lower cortisol levels at night?
The cortisol level at night could have possibly been due to chronic stress disorder. It could have been resulted from disruption in the sleep-wake cycles. So if we have this habit to stay well into the night and sleep late and wake up late, that will be counterproductive for the cortisol level production and maintenance in the blood. So what I would recommend is that self-quieting habits, mindfulness-based practices, and having all the proper habits before going to bed. Also making sure that the sleep environment is quiet, sleep friendly, and keep the sleeping room like dark and cool as much possible. And also having this regular habits and consistent habits for sleep. These are actually going to set the ground for regulation of excessive cortisol, because cortisol naturally peaks somewhere in the morning, somewhere 7 to 8 a.m. We have the maximal peak in the cortisol level. That's true. And that is based on our sleep-wake cycle. When we have sleep-wake circadian dysrhythmia or disorder, we need to make sure that are we in sync with regard to that sleep-wake timing? If not, if I'm staying awake all the night and I'm depriving myself from sleep, and the next day I'm catching up some sleep, which is lost from last night. And I do this because I've heard somewhere that, okay, that's the quantity, the number of hours of sleep. For me, it's still like 6 to 8 hours, so I'm still good. But it's not right. There are 3 things which should be followed. If those 3 things are not there, then the level of cortisol will be peaking. The first is the sleep duration, right? Second one is the sleep efficiency, the quality. Number of hours, quality. And the third one is the timing, or the circadian timing measures. If these 3 are in check, we don't expect the cortisol level to be peaking before early morning hours. If that is not the case, sometimes we need to seek medical advice, get tested for the sleep integrity and also those biological measures to find out what would be the possible reasons, what is actually causing this. And we will be hitting the ball out of the park when we find exactly what is the culprit and precisely target that certain culprit, right?
Last question from my wife. How would you encourage women to take sleep advice from a man? And maybe this one is directed towards me.
This is not easy. I mean,
No, it's not.
yeah. But
Maybe we should just move on then.
yeah,
Okay.
I would say so. Yeah.
So you mentioned a couple of things that I wanted to swing back to. Is it possible to catch up on sleep, right? So if I have a couple of late nights for whatever reason, forget about alcohol being thrown into the mix, just a couple of late nights, but on the weekend comes, can I catch up on the sleep that I would need, or that I would normally, instead of getting 8 hours, I'm getting 6 for 2 nights in a row?
Yeah. We need to have this, the balance track record of sleep with regards to the number of hours we take sleep, and it differs from person to person. But on average, people need 6 to 8 to 9 hours of sleep. It differs as per the age range and also individuals. But overall, yes, as you said, 7 to 8 hours of sleep is a good number. But what happens if I lack 2 hours? So I'll be -2 tonight, and down the road, I'll have -3, -4, -2, -1. And when it comes to the weekend, I'll be +3, I'll be +4. Good. But When we put them all into a balance and we make that equation, it should be not alarming. And what do I mean by alarming? There has been evidence-based findings in scientific research back in time, and that has been also replicated in more recent scientific studies, that chronic sleep restriction and sleep debt is a very important thing. And unfortunately, we're facing a global sleep deficit, right? And that is owing to the modern nature of today's life. Here's the thing. When over 2 weeks we have the cumulative sleep debt of 48 hours that has been proven to be very detrimentally, affecting the brain. If I have accumulated 48 hours of sleep, I wouldn't be able to have my cognition in place. My mood is all over the place. I would not be able to regulate my thoughts and emotions. I would not be able to be physically fit. My motor and sensory and behavior function will be disrupted. As if I have the alcohol concentration in my blood as point 0.1 milligram per ml. So if I have that concentration of alcohol, this means that I'm trembling, right? I'm not able to focus. I'm not able to concentrate. I'm not able to talk. I'm not able to have good executive functions or decision making and this and that. And that exactly happens in chronically sleep deprived individual. By chronically sleep deprived, the ceiling is 48 hours cumulative sleep debt over 2 weeks. But it's like a bank.
So what is that?
So I'm taking a loan from the bank.
Yeah.
If I take that loan from the bank, I need to be certain, would I be able to repay it?
Right. So 48 hours over 2 weeks, doing the math quickly, you're talking about maybe 3 hours less sleep a night for 2 weeks. And then that has the same effect as being almost certainly intoxicated, maybe drunk.
Absolutely.
Okay, now what about those people? And I'm trying to think of well-known individuals who have spoken about how they actually operate with maybe a 5 hour sleep a night. The one that comes to mind, I don't know why it's this person, but I'm going to mention him anyhow. Bill Clinton, former US president. He was well known for somebody who didn't get a lot of sleep at night. Now, I don't know if that was a health thing or if that was just a personality thing or a job situation. The rumor is that Donald Trump is also very active during the night as well. Are there cases where some people just don't need the traditional 8 hours? They can actually work with 5-6 hours as their base of normal.
Yeah. There are definitely inter-individual differences, and we have exceptions. But exception is far beyond the rule. The rule says that majority of the people need that quality and quantity and timeliness of their sleep and wake framework. But when it comes to exceptional people, it might be true. Medically, that has not been proven to be safe, because we might have like 1 or 2% of the people that they are regarded as significantly shorter sleepers, right? But that doesn't mean that if they keep being sleep deprived in long run, they are still going to be on top of what you're doing, and for sure the performance is being negatively affected, and that's been proven scientifically in a compelling body of the research works over the past several decades. We know that 48 hours of continuous total sleep deprivation has been very detrimental, not only to the animal models in the lab studies, but also to the human. And the longest duration of time that a person has deprived himself, he's dedicated his brain and his health to the study, and his name was Randy Gardner. He went for 9 days in a row sleepless, right? And ultimately he became delusional. He started hallucinating. And
when you say how much less sleep was he getting?
He was like completely, totally sleep deprived for 9 days.
So no sleep.
No sleep at all for 9 days in a row. And after end of the first week, he started to be completely dazzled in a way that he was not able to interact with the surrounding in a good way, and he didn't have that mental clarity anymore. But at the end of this journey of 9 days, he kind of like experienced absolutely delusional state, and he has had hallucinations, and he even started to feel like completely distorted with the autonomic features and shivery, and then he ended up with seizure. So this can be completely lethal if someone puts himself to more than 10 days of complete total sleep loss. So sleep loss will kill us quicker than hunger.
That
Right?
is incredibly interesting. It's also interesting to go 9 days without sleep. I wouldn't have thought that you could physically maintain that. Would he have been on anything to keep him awake?
He was actually consistently being keeping engaged, playing chess, doing this and that. All
Oh,
right.
so it wasn't
So
like
if
he
it was
was
he was
caffeinated.
being under the surveillance. No caffeine and nothing. But
No.
people were just keeping him engaged, and he was consciously into that experiment of depriving himself from sleep, and he was getting engaged to refrain from sleepiness. Right. So it was running on day and night.
Because we could go, to take up your point there, we could go, what, a couple of weeks, maybe longer without food, maybe water, yes. And certainly we could go, I'm guessing, a month or so before we'd have to be hospitalized. That is amazing. So, do they know at what point, at like day 9, you're having seizures, but at day whatever, you would die,
Yeah.
which would be how many days without sleep and you would die?
I don't know about the other experiments in human, but we have tested that on animal models. We're testing the rats, and 48 hours of total sleep loss in rats has been very detrimental to their cognitive function, to their overall bodily and physiological health. And over 2 weeks of partial sleep restriction, like the analogy of
Hmm.
what we discussed about, like 48 hours or 2 weeks of cumulative sleep debt. And we kind of trying to replicate that model in the animals, but following through all the ethical rules, of course, and as much as possible based on those guidelines that they are already in place. They were eating 3-4 times higher, more than before, and they were losing weight on the contrary, right? So that was like the immune system was disrupted. They started to have some ulcers on their paws, on their the furs were losing, and the rat was completely emaciated, and they eventually died, right? So this means that it is essential. But for some people, as you indicated, still sleep is considered as a luxury. They say, well, sleep is a time lost. Okay, we're super active, we're very competitive, we're over accomplished, and we're going to spend that hours during the night while other people are asleep. We are doing the trick. It's not a helping attitude towards overall health. Apart from a bunch of evidence that we still have, you know, they are being, even more investigated in more details these days. We still have this very in-depth insight about that. When sleep loss is the cause of you know biological problems or medical illnesses, it's not only about cardiovascular strain and cardiovascular incidents. It increases the likelihood of cerebrovascular events to 3 times plus more. Also, we have 3 types of cancer that they are correlated with sleep, chronic sleep deprivation and sleep loss, or inefficient sleep over years: breast cancer, prostate cancer, and colon cancer. So these 3 cancers are actually being linked to sleep deprivation. Also, we have cognitive issues like lack of mental clarity, early onset dementia of Alzheimer's type. And it's been completely studied in different realms of research models, and it's been documented that poor sleep quality and quantity in long run may foster and speed up the process towards the age-related memory loss and memory problems and of Alzheimer's
Mm.
pathology type. Oh, it is detrimental in many things, and it increases the level of cortisol. We have emotion and mood dysregulation during the day after sleep deprivation. Also, would be having like overeating things, and it increases the risk profile for metabolic slowdown and obesity, Also, we have problems with the immune system and the hormonal imbalances. So many consequences are there. But is that all? We are now emphasizing more on the number of hours that someone takes sleep, which is very important. That's one of the main pillar of those three. But the timing we also allotted to, it's very essential, and the regularity, the consistency. But one other thing is the efficiency. Sometimes I'm not aware if I have a quality sleep or no. But the evidence that I can tell you is that when I wake up in the morning, I feel unrested, not refreshed, and not ready to start the day. I might be present at work, but I'm not performing well. And I have this excessive drowsiness or overt sleepiness during the day hours, diurnal fatigue, and I have this issues with my memory, concentration, mood dysregulation, and lack of behavioral or sensory motor aptitude. How do I ascertain that I have a quality sleep? I can just tell that my poor quality of sleep resulted in my poor daytime function. But when we check the sleep parameters, it turns out that it might be due to many different reasons. We might be having autonomic dysregulation, problems with the heart rate variability, problems with the fluctuation of the blood pressure or the bodily temperature during sleeping hours. Some people might have had problem with breathing, and we have a certain category of sleep problem which is called sleep-related breathing problem. It's huge, and 6 out of 10 patients that I see at the clinical setting, they are suffering from some degrees of sleep-related breathing problem. Starts with snoring and flow limitations, hypopneas, apneas, and we have mild, moderate, severe, profound. What does that cause? When we have flow limitation and apnea, hypopnea thing, problem with breathing during sleep, gasping and stuff overnight. It results in frequent dips in the oxygen level saturation in the blood, which we call it intermittent hypoxia. This intermittent hypoxia increases the risk of stroke, cardiovascular accidents. It increases the risk of metabolic, immune problems, many things. But one of the clear consequences with that of that would be sleepiness during the day. So they have excessive daytime somnolence, right? And they might have near accident experiences because of dozing off the wheel, and or they might be having issues at work. They might be having even family conflicts, right? So they are completely erratic with regards to their capacity of performance, that they used to be doing fine, but today is not the case.
Let me ask you this. So we talk about the quality of sleep versus the quantity of sleep. What if, and I'm not one of these people, and I think the world is divided into people who love naps and people who hate naps. I'm one of the people who hate naps. I truly think nap time is wasted time.
Mm-hmm.
Are there benefits? Maybe you're sleeping 5 hours a night, but you do nap, say, for a good 45, 60 minutes during the day. Can a good cat nap help offset either a lack of sleep or a lack of quality sleep at night?
Yeah, it is actually been investigated, and scientific research have been informing us that short naps, what we call a power nap or siesta in Spain, when they are taken for a shorter period of time, maximum 40 to 45 minutes in the afternoon hours, they might be helpful for cognitive fitness and behavioral emotional reset. So that will be beneficial. We have beneficial, expectations from those short naps. Do they hamper the quality and integrity of overnight sleep? If they are extended naps, yes. But if we keep them to less than an hour, they would not be interfering and they would not be hindering the quality and the timing of sleep overnight.
But would the nap itself help someone benefit? Would that contribute to a 24-hour cycle of healthier sleep?
Yeah.
It would.
Yeah, it will. But yeah, as a sleep expert, being in the field for 20 years, if I'm asked this question that if I can, should I take nap in the afternoon? I would say yes. Because there are positive sides of afternoon naps rather than it's a very good thing. It's not evil, right? So if someone
it is evil. In my mind, it is evil.
So if someone can take a short nap, again, I'll reemphasize on the period of time that we're spending napping in the afternoon. But daytime napping is a good thing. And it's not my viewpoint. It has been evidence-based, and that's been backed up by scientific research over and over again for the past several decades. We published papers on that, and in high-performing individuals, we compare those who have this habitual nap in the afternoon as opposed to those who do not take nap. And our findings informed us that yes, afternoon nap will actually reset and refresh the cognitive agility and the speed of the processing of information in the brain. That will be able to be more agile and more accurate in the cognitive testing as opposed to those people who do not take naps. So in general, it is not ill-advised.
One of the things I've discovered as I've aged, as I've become more mature, shall we say, is that I will, despite accusations my wife may level at me, I will get stuck thinking about something that might prevent me from sleeping or falling asleep. I will listen to old radio dramas from the 40s and the 50s. Partly because they're interesting enough that I feel I need to listen to them, but not so interesting that I need to stay up. They will help me fall asleep. I never had that issue when I was younger, but I would say, I'm 59 now, so I would say maybe around the age of 50. Now, I'm not sure if that's because my kids had gone home for university.
59.
At 59, yes.
Are you serious?
Yes.
Wow, you're great for 59.
Thank you. So I wonder if the kids were home back in Canada for university, and maybe that was contributing because they weren't just down the hall. And, you know, as a parent, you're going to have anxiety. Or if it was something else. So I guess it's a two-part question. The first one, as we get older, do we traditionally have do we have more trouble sleeping? And then the second part of that is, why would my version of white noise help me sleep?
The first question, if as we get older, do we necessarily get into problems sleeping as good as before? Not necessarily, but the need for sleep becomes less as we age.
The need for
The
sleep
need
is
for
less.
sleep is less.
So
By
I
1 or
need
2
less
hours.
sleep?
By 1 or 2 hours on average across the
Really?
people.
Why?
Yeah.
Okay, now I have to ask you, why is that?
Yeah.
Is it because I'm not as active?
That is like actual trend of the sleep need. Why do we have way higher sleep needs in infants, right? They sleep like 16 hours per 24 hour. But based on the peculiar need of the brain and the bodily biological systems, we have differences in the need for sleep pattern across the lifespan. When it comes to elderly population or senior people, they have less of the sleep need in general. Why do they have problems with sleep quality and integrity? Why they are complaining about their sleep? And they come to us saying that my sleep is not serving that level of freshness and ability to start a day the next day. Why is that happening? It might be organic sleep problems. And again, reiterate myself, we have more than 80 types of sleep disorders. Might be different types of sleep problems overlapping, and there's like the paper thin divide between those sleep problems, but they're overlapping. But we need to pinpoint and spotlight what is the exact problem with the sleep to be able to target that precisely. Brackets closed. They might be having issues with the circadian pattern because of the pineal gland disruption, the pineal gland degenerative changes, and those pineal sands, right? So we have less of the melatonin, not only melatonin, but also adenosine level, moramyl peptide level. These are the other chemicals that you're fluctuating across the lifespan. So they have less of the chemical background, essential needs in the brain to be able to maintain that hypnic tone. They have fragmented sleep. They got easy arousability during sleep. They have the sensory gating problem with a little bit of sound or light. They become very, their sleep becomes fragmented. This might be the cause, and in that sense, we'll be helping them behaviorally. We'll be helping them through the use of medication supplements. Sometimes we're letting them undergo a set of training programs. We call them cognitive behavioral therapy for insomnia. And that is actually at least like 6 to 7, 8 sessions. We're helping them to be able how to control the external stimuli and internal stimuli to break that thought and stress loop, because we have anxiety and a sleep loop. Sometimes we out of nowhere we get into that rabbit hole. So we get super anxious during the day, not being able to sleep well. We don't sleep well, we become super anxious again the next day.
But should we, just as an aside, should we, as we get older, accept that, oh, I don't need the same 8 hours that I needed when I was younger? Should our baseline be if I get a good 6 hours? So instead of going to bed at 10 and then waking up at 6, should I be thinking, oh, I'll go to midnight,
But again,
bed at midnight and get up at 6?
maybe I was not clear enough. Let's back up.
Sure.
Yeah. The thing is, it's a statistic measure telling us that overall senior people need less sleep. Does it mean that I, as a person, I'm going to cut my sleep by 2 hours because Nami told so? Not really. The thing is that how much sleep do I need, do I require, regardless of the age? My answer will be, listen to your body. If you're not okay with 6 hours of sleep, if your sleep quality, if your sleep integrity is not there, something is not definitely right. So you need to take measures to improve on that. If 6 hours doesn't do the trick for you, you got to catch up some sleep, go for it. So we got to listen to your body because there are certain inter-individual differences. Some people are long sleepers, some people are short sleepers. But short sleepers, not in a sense that you brought some examples that, okay, I'm the superhero, I don't need sleep, and I'm going to invade the night hours and do much more than you. I'll be doubling my life by sacrificing my sleep. I don't need to sleep. That's the time lost.
Okay,
No.
now what about this? It's 10:30. I'm exhausted. I go upstairs, brush my teeth, get changed, maybe have a quick shower, whatever the case is. Maybe I've showered earlier. Maybe it's just brushing my teeth. Minimal activities from the time I'm exhausted to the time I want to go to bed. And then I get into bed and all of a sudden I'm now wide awake. What's going on there?
Again, in the brain, there are brain wave patterns, and those patterns of brain waves are generated from millions of neurons. They're forming the circuits and the networks. We have different areas at the surface of the brain that they are mostly implicated in the process of cognition, thinking processes. Parts of the brain are responsible for emotion regulation. So this is my brain. Here, the front of the brain would be more of the cognitive processing control. The sides and the temples of my brain on the left side predominantly will be involved in emotion control. And we have this cognitive emotion regulation, the constant battle between thoughts and emotions. When I review all those negative thoughts, because you know that constitutionally we are more prone to the negative thoughts.
Sure.
And newspapers with bad news will sell more than newspaper with good news. So I just, reverberate those negative thoughts. And then that causes ignition in my emotional part of the system. So this back and forth conflict between the cognitive and emotional part of my brain will actually disintegrate in long run, what we call it overthinking. This will disintegrate the part of the brain responsible for generating the hypnic tone, the natural ability of my brain to experience quality of sleep and have that shut eye, right? So as if biologically and organically, something is happening maladaptively in my brain, as if my brain forgets how to fall asleep and how to maintain sleep, right? And that results in something, we'll call it chronic insomnia disorder. The chronic insomnia disorder might be a primary issue. It might be physiological, it might be psychological. So we have psychophysiological insomnia, or PPI. And in essence, this PPI might be quite something that we need to target it psychologically through CBTI, or that there might be a medical or kind of like intervention to remediate those challenges that the person still is already facing. Other reasons, insomnia is only one pillar of the different categories of sleep problems. Other categories of sleep problems, including what we discussed about, sleep-related breathing problem. Also, we have sleep-related movement disorders. We have parasomnias, sleep talking, sleepwalking, teeth grinding, and many other abnormal behaviors during sleep, laughing, crying, seizures during sleep. So there are many reasons that we might not be aware of, so we need to get tested if there's a question mark for that. The other one, which is also very important, is the sleep-wake circadian pattern. So if for any reason I'm not following through the proper healthy sleep-wake cycle, circadian patterns, I might be having that issue. So 5 so far: insomnia, sleep disordered breathing, sleep movement disorders, and we also have problem with parasomnia, abnormal behaviors in the sleep, and circadian rhythm. And the last one is what we call it. It's not a sleep disorder, but it is more of the daytime sleepiness problem. That's what we call it central disorders of hypersomnolence. So people become over drowsy and sleepy during the day. They cannot maintain wakefulness. But if I want to relate insomnia to those things, there is a cross relation between the insomnia related problem with any of those things. This and this and this and this can negatively inform insomnia. They can be the cause of insomnia. So it doesn't mean that, all right, cool, I have insomnia, so there are sleep aid medications. I go to my psychiatrist, get that prescription, bingo, done. I'm going to take that medication. I will sleep well as of tonight. Many of those medications will intoxicate the brain in the long run, and they are very addictive. They may cause tolerance and dependence in medium term, long term, so they are not safe to be taken in long term. And we've learned in the field of precision sleep medicine how not to prescribe medications for sleep, right?
So, but I wanted to ask, again, I asked, but I want to get a more defined answer. So why is it that if I listen to something, that will distract me enough from thinking so that I'll be able to fall asleep?
You will be able to get that disruption. I shared with you this. Your brain, my brain, would have literally forgotten how to fall asleep. Okay, how to get this tranquility, how to get that shut eye. Our brain is not able to do that, right? So if we try to lessen the intensity of this back and forth battle between the cognitive and emotional part of the brain, actually we're easing the cognitive processes in the brain. But how do we do that? We get involved in something to fool the brain, but it's called mindfulness. But when we say mindfulness, it doesn't mean it has two L's, it has one L. So mindfulness with 2L means that I'm just wondering about all those back and forth thoughts. And those thoughts will trigger emotions. Not helping, but if I go for this mindfulness, I need to reconcentrate on something. Listening to white noise, concentrating on my timed breathing pattern, right? 4 seconds in, 7 seconds hold, 8 seconds out, and then I go for this over and over again. I'll complete that cycle. I focus. I become super vigilant about my breathing pattern. So I'm actually filling up my brain space with only one single thought.
So by distracting your body, essentially, or distracting your mind because your mind becomes focused on one thing, then your body remembers how to fall asleep?
Absolutely, because there should be a harmony between the central nervous system and autonomic nervous system. When the harmony is not there and the central autonomic structures are not in good check and they are disintegrated, then the bodily nervous system keep misinforming the brain, igniting more and more of the minuscule levels of neuroinflammation. That neuroinflammation would be embraced by the emotional part of my brain. So my emotional part of my brain will remain on fire, and the cognitive part of the brain loves that because it needs to get into this discourse with the emotional part. So this discourse between the cognitive and emotional part of the brain actually disrupts the whole case scenario. My body keeps unrested. My body doesn't send those signals that, look, you want to shut down, okay? You want to calm down yourself. But my body will not be able to inform the brain about that because the brain has not been able to inform the body about that. They are not traveling together, right? So when we get that back on track by remediating the waveform patterns in the brain in a way that those networks are more harmonious and orchestrated by mindfulness-based cognitive practices and quiescence and self-quieting skills that I cultivate and develop myself, over time my brain will remember. What would it be like if I want to have that quality sleep back on track?
Mohammed, thank you for joining me. I
Oh,
appreciate
thank
it.
you. Thank you for having me here. It's been a total pleasure.
My pleasure.
Absolutely. Thank you so much.
Thanks.